any graduate of a PharmD program is a highly motivated person with an ability to learn. So, with these two traits alone, that can open up many different non-traditional career options.
Hello, everyone. Welcome to the latest episode of the current Touro University California's Alumni Podcast. I'm Glenn Faison, coming to you from the Office of University Advancement here on campus, Mare Island, California. Joining us today as our guest is Dr. Kevin Carrasco. He's a dual PharmD MPH grad from 2013 out of both the College of Pharmacy and the College of Education Health Sciences. Dr. Carrasco is an Emergency Department Pharmacist at Banner University Medical Center in Phoenix, Arizona, which is where you're joining us from today in Phoenix. So, Dr. Carrasco, thank you for joining us.
Oh, it's my pleasure, Glenn. Thank you for inviting me.
It's my pleasure to have you. Hey, let's just jump right in. Why did you choose to attend Touro University California? And kind of as a follow-up for that, why did you opt for the dual PharmD and MPH degrees, Master of Public Health degrees?
Yeah, that's an excellent starting question. So when I was applying for pharmacy school in 2009, I was mainly looking at schools of pharmacy in California. And out of the several interviews I had and offer acceptance letters, I was really attracted to their 2+2 program, which was something that was available when I matriculated there. And the 2+2 program was, the first 2 years were mainly didactic, and they focused on developing a strong foundational knowledge base, which is something I really jived with, but more so, years 3 and 4 were devoted to clinical practice rotations. And at the time, I was already a pharmacy technician, so I had been in the workforce, but not in the capacity of like an intern or pharmacist. And I knew that I think hands-on learning was more beneficial to me and my long-term career goals. So with that, they offered a wide variety of rotation options with the 2 years of rotations or experiential learning. They have flexibility in scheduling, are required in elective rotations. And overall, it just extended the clinical training, and that meant that I would probably be more well prepared for patient-centered care responsibilities upon graduation. Moving on to the dual PharmD MPH or Master's in Public Health degree, this was something that I didn't initially have an interest in when I first started pharmacy school, but it was something that I gained interest in during my second year in pharmacy school. I was meeting regularly with like our campus advisors, and I started to learn more about the role pharmacists play in like the public health arena. And I felt that this additional training would be something that could benefit me throughout the course of my career. And I'm really glad I made that choice to enroll in the dual degree program, because it really gave me a deeper understanding of areas such as like program evaluation, needs assessment, and some research methodology, and also like social aspects of public health. These are some of the courses that were required during that program, and those are the courses I enjoyed the most. So this was a gateway for me to get involved in different areas of my job. Particularly things that interest me currently are like designing quality improvement projects at my hospital and getting involved with committee work and improving like resource utilization with our healthcare system that is already strained as it is. So just in summary, that was really a smart choice I felt I made during my education at Touro University, because the tools I learned in the public health training really came to help me out with currently what I'm doing and what I have been doing for the past 10 years.
Well, that's great. So why don't you tell us briefly about your career arc since you graduated from Touro University, California? Where'd you go after you left here, and just to the point where you ended up in Phoenix?
Well, let's just start off and say it was a bumpy road, and I didn't really know exactly where I'd end up and where I am currently, but I'm glad that everything worked out in the end. And since graduating Touro in 2013, I went on to complete a postgraduate year 1 residency at the Southern Arizona VA healthcare system, and that's in Tucson, Arizona. So that's initially what brought me from California to Arizona. And then after graduation, I was an overnight staff pharmacist at a 200-bed hospital in Phoenix, Arizona, also at the VA, and I did that for about a few years. And then I actually went back to Santa Rosa, California, which is closer to Touro University. It was a hospital. Yeah, it's a hospital that I did my API rotations at. And, I guess I left a good impression with the staff there because it's kind of more or less a rural hospital. And I was recruited by another Touro University alumni who just, out of the blue texted me, one of my classmates, saying, "Hey, you looking for a job?" And I said, yeah, I'm kind of, getting a little burned out on the overnights thing that I've been doing for a few years. And, she said, hey, we're really strained. We're recruiting. We're offering a sign-on bonus. And, if you're interested, maybe you'd want to join. And at the time, I had a California license, and I could still work in Arizona because it was for a federal healthcare system. So I did a phone interview, and most of the staff that interviewed me were also my preceptors at the time when I was a student. And so they said pretty much, you already got the job. We're just giving you this interview for formalities. We looked at your CV. You're completely qualified, and we remember you as a student, and you were, a very good student and very smart, and you're the type of person we want with our staff. So once again, it was just good luck that they remember me, and I left a good impression upon them. And I did that for about a year and a half, and that was kind of my introduction into emergency medicine, because they had like a clinical staff model where all the staff pharmacists rotated through the different clinical scenarios there, whether it's telehealth, oncology, staff room IV pharmacist, and emergency medicine. And then after leaving that job, I went back to Arizona and became a clinical pharmacist at a bigger 700-bed hospital. And that's where I kind of acquired my current job as an emergency department pharmacist. And, I fell in love with it, and I've been doing that ever since, so about the past 5-6 years of my career.
Well, that's great. So you touched on this a little bit, so I'm just going to use that as a nice way to segue into the next question, which is this. When most people think of pharmacist, just kind of a regular person thinks of pharmacist, they're probably thinking about the person that's filling their prescription when they've gone to see their doctor because they're not feeling well, and their doctor wrote them a script and they went to their local pharmacy to pick it up. People who maybe had some kind of procedure in a hospital and they're staying in the hospital, they may have been familiar with the person bringing their medication, but that might not have even been a pharmacist. There are all kinds of different roles that people with a PharmD can take on in the field of pharmacy. Why don't you take a few minutes to describe for our listeners, what some of those options are?
Yeah, it's really quite amazing how many different avenues or niche positions pharmacists and PharmDs can find themselves in. I think we have a unique ability to find an area of improvement and then segue into areas that we can offer some assistance to. But for me personally, I've spent my entire career in the acute care setting. Prior to that, when I was an intern, I was working in the retail setting, and when I was a pharmacy technician prior to pharmacy school, I was also working in the retail setting. But throughout my career, I've seen pharmacists take on more and more direct patient care responsibilities, whether they're directly consulted by providers for their expertise, or whether it's been incorporated into their daily workflow through things like collaborative practice agreements or hospital policies and protocols. So for me, currently I'm working in a large academic medical center, and I feel that anyone being trained in this type of environment will become familiarized with the concept of patient-centered care from like a multidisciplinary team approach, which involves the incorporation of a clinical pharmacist as part of that team. With that, I feel the role of a pharmacist on an interdisciplinary team will only further increase over time. I could also speak to what I know about some of the more traditional career options that you mentioned, and some things that maybe some of our audience can be expected to enter after graduation. And I could probably just use myself as an example. So while, like I said, in pharmacy school, I was employed in the retail setting, and I really enjoyed it a lot. I really liked that social connection, getting to know your customers and being a part of that community. But during the last 2 years of my pharmacy school, something about doing that postgraduate year one residency caught my interest, and I decided to apply myself to various different programs that offer training in both ambulatory care and acute care. I think Touro University does a really good job of preparing pharmacists for the ambulatory care setting, now that I could look back on my training and understand what that job role looks like. But during my residency, I quickly found out that I was very interested in acute care or hospital care pharmacy. And I chose that as my career path after residency, obviously. And, as we talked about, I ended up changing my job a few times until I finally discovered my passion for emergency medicine, which I never knew that there would even be a pharmacist president in the emergency department, helping with critically ill patients. So that's a very unique, job position. And then with that, so segueing into other things, as an emergency department pharmacist, I had the privilege of precepting APPE students from two of the local colleges of pharmacy. And then through that, I got more involved with academia by becoming an adjunct faculty member and doing workshops and classroom lectures on campus. And I really enjoyed interacting with pharmacy students after I had graduated, and of course interacting with some of the faculty on campus. And now where I am with that, I could see myself transitioning into solely a career of academia if I ever decided to, walk away from my current role as a bedside clinician and working, bedside with patients who are critically ill. I'm also fortunate that we have our PGY1 pharmacy residency program at my hospital, and I had the pleasure of being a research advisor for some of our residents. So, segueing into another position you could find pharmacists in is research. It's a niche area that I think pharmacists can play a huge role in and contribute to, the advancement of the profession and patient care in general. The practice of medicine is rapidly evolving, and through high quality research, we can find guidance on some of the most effective and safest treatment options for our patients. So, I never thought I'd have a passion for research, but when I got approached by some of our residents to be their research advisors, it's actually a lot of fun, and it's a great learning experience. The learning curve's pretty big, but there's a lot of support systems out there for you. So if you haven't been involved in it yet, I would recommend giving it a try. Start small and build your way up. I also think that it goes without saying that any graduate of a PharmD program is a highly motivated person with an ability to learn.
Right.
So, with these two traits alone, that can open up many different non-traditional career options. I've worked with plenty of pharmacists throughout my career that started side businesses as a way to supplement their income, or, just because they found enjoyment in doing other things that were completely not pharmacy related. So, just because you graduate with a PharmD and you get your license and you're a pharmacist, it doesn't mean that's going to be your lifelong career. You're a talented, motivated person, so if something else interests out you, don't be afraid to approach that and take a risk and try to see if you can start a business, and maybe it'll help supplement your income, or maybe just do it for fun. So I do some things on the side, and I really enjoy them a lot, and my wife enjoys it with us, so it's kind of a thing that we bond together on.
So it sounds like there are enough opportunities there that that there will be plenty of opportunities over the course of a career to keep things fresh, as it were.
Yeah, as you say, the world is your oyster.
Okay, great. So you touched on the role of pharmacist during your previous answer. So why don't you describe for us in a little more detail the actual role of pharmacists in patient care? I know there's a patient education component, advocacy, but there's also the promotion of public health, which goes in line with your MPH degree as well. And also, how does this show itself in a working emergency department?
Sure. I mean, I kind of have a generalized approach to that term or definition of patient care, and it's something I teach my students and my residents, so I'll kind of give you guys my same perspective on that. So I believe the type of care pharmacists provide to patients should be consistent in any practice where we are involved with services attributed to patient care. So whether you're an acute care pharmacist, hospital pharmacist, emergency department pharmacist, retail pharmacist, medical liaison pharmacist, any role, still the outcome or the focus is your patients. So first and foremost, we need to know about our patients. And that means collecting necessary information about the patient in order to understand, their relevant medical history of the patient or what conditions you're going to be educating them about. And then once you know your patient or your patient audience, we can assess this information in order to identify and prioritize what problems need to be addressed first and foremost. And then with that information, we can formulate an individualized patient-centered care plan. And if you're so lucky, you could be collaborating with other healthcare professionals and or their patient caregivers. After you've formulated this plan, you need to implement it. And it is important, this is probably the step that we forget about most, is to follow up with the plan, and so that we can monitor and evaluate the effectiveness of this plan and modify it as needed, of course, with the goal, with the patient being, the center of our attention, and making sure that they're getting the most bang for their buck, their treatment plan is effective and safe, and doing anything we can to give them the best healthy lifestyle that they can live. So that's kind of my generalized approach to just the patient care question. And this should be cyclical in nature. So it just kind of keeps going around and around and around, using these components as a framework or a structure to provide the best care for our patients. About patient education, I think, we as pharmacists should always seek out opportunities to educate and counsel our patients or their families or their caregivers about, the medications they're taking. And this can be done so that they have a better understanding about, the health conditions that they have and what role the medications play in helping them live healthier lives. In the emergency department, I get the privilege of talking to a lot of patients at the bedsides, and if they're too ill to talk, usually I'm talking to their family members or caregivers, and it's just surprising how much little health literacy these patients have about the conditions they have as far as like health situations. And I'm interviewing them, doing medication reconciliations, trying to see if there's any drug-induced reactions that they're presenting to the emergency department for. And so, every opportunity I have to educate them, like, well, you're taking this medication for this condition, and I just try to empower them through this counseling and education every chance I have, even though that it might not be the reason why I'm even there in the bedside talking to them in the first place. It's just an opportunity that I say, hey, it can only take a few seconds or a minute to just give them a little bit more education that might have been lacking throughout their whole journey through the healthcare system. I think, you should also take a moment to inform them about any of the serious side effects or the complications they can experience from taking these medications. Once again, just so they could be empowered to speak up to their healthcare providers if any of these undesirable effects occur. Moving into like another topic that I'm really passionate about is advocacy. So, I feel since the days of 2009 when I started pharmacy school, and 2013 when I graduated, and moving forward till now, our profession has definitely come a long way since the days of primarily being medication dispensers. Like we've talked about earlier on this podcast, we've created a lot of subspecialties for ourselves and unique positions that have attributed to a lot of good patient outcomes. I've definitely seen our autonomy grow, and we're taking on more and more direct patient care roles and activities. And the more involved we get, I think it's almost become an expectation in the eyes of newly licensed medical professionals or some of those that are still currently in training. I work at a big academic hospital, and it's a teaching hospital, so a lot of the medical residents that I work with in the emergency department, already within their training, they're told by their attendings to go see the emergency department pharmacist for help. Go bring him or her to the bedside to resuscitate patients. So I look at them, they're going to go on to be attendings themselves, and they're also going to have that expectation that this pharmacist is part of the resuscitation team. This pharmacist is an actual body in the department that we utilize daily for our resources and expert consultation. So just by setting that example as role models, I think it's helping to swing the pendulum that this will be an expectation that pharmacists need to be a part of that patient-centered care team. And I think this is kind of what I say grassroots advocacy, where they're on the front line, showing the patients, showing the providers what all the skills that we can bring to adding value to the patient care. And then lastly, like you talked about, the promotion of public health. Well, I think there's a lot of opportunities for pharmacists to get in public health initiatives. For example, we can provide our expertise in developing disease prevention programs in the community, as well as, always promoting medication safety efforts at healthcare facilities or in the retail setting. I kind of touched on it before, but we can also get involved with research and education programs that are not only geared towards our patients, but also healthcare providers as well. Every quarter, we have an emergency department physician Zoom call where we kind of just talk about different topics that are unique to our practice. And I always ask to carve out about 15 minutes so I could talk to all the doctors in the emergency department, all the PAs, all the nurse practitioners, and anyone on that phone call. So I have my 15-minute medication corner where I tell them things that I think or trends that I think that they can improve on. And I definitely see practice changing habits almost immediately after my talk. So, we got to be there also educating the medical providers too. So In fact, the list of public health initiatives that we can be involved in is really never ending. But in summary, I would say that if you see an area of improvement in your day-to-day job, then you could probably look at it from like a public health perspective and find ways to make like a positive change that are both based on feasibility and sustainability. Some of the two terms I learned during my public health training. So whenever I'm tasked with a project, the first thing I always look at about, is it feasible? Do we have the resources, manpower, funding to even take on a project like this? And then should we take on the project development, you should always think about incorporating sustainability into it, because once the chief person who's running the project walks away, who's actually going to carry that torch? So try to make sure that the project is almost self-running itself, and you'll be very successful with what you do in your public health projects.
Well, that's outstanding. So again, you're touching on other things that I wanted to touch on as well. So I'll jump around a little bit. Tell us a little bit about your experience with mentorship, both as a mentor and potentially as a mentee. I'm sure you've had mentors, either formal mentors or informal mentors throughout your career. What are your thoughts about the importance of mentorship in the pharmacy profession?
That's a really good topic, Glenn. I'm glad you asked that. I think mentorship is something that's crucial to our profession. And I definitely wouldn't be where I am today without the mentorship of good role models throughout my career. I feel this to be especially true when you're like a new practitioner. Everybody in our profession wants to see you succeed. Nobody wants to see you fail. And they want all these people with more experience, they want to offer their expertise to you early on. So my best advice to anyone who is going to be a recent graduate or upcoming graduate, my best advice is, seek out a good mentor, someone who's a good trainer, or someone that you seek as a role model. And if you can, learn as much as you can from them. I don't think you're going to turn them away by you being inquisitive, because I think they'll feel valued by someone looking up to them for, training or expertise. And this person or these people, well, they will be an invaluable part of your career development and can help you build your confidence and, of course, competence. I remember my first job after residency was being a night pharmacist in, 200-bed hospital. And I would see a lot of things on the overnights that didn't quite make sense to me early on in my career. But luckily for me, I had made connections with the other night pharmacists at my residency program. And before I left that program, they all said congratulations and good luck. But they also offered to help me out, knowing that I was also going to be a night pharmacist like they were. And they gave me their work number or cell phone number, or we could Google chat or chat online. And so every time I'd log in for my night position, they would pop up and say, welcome aboard. And I knew right then and there, there was always someone I could reach out to phone a friend.
Nice.
And so, it was beautiful, because going in as a night pharmacist, the only pharmacist in the hospital right out of residency, it's kind of scary, but I was up for the challenge. And of course, that was the comfort blanket I needed, knowing that no matter what, if things get a little hairy, there's always someone I can call on to help me out. And I can't even tell you how many times I said, this is going on, and how would you approach it? And they were more than happy to say, hey, pick up the phone, I'm going to walk you through it. So it was really good to have them in my corner. And of course, over time, I also learned my own experience and was able to address similar situations. It's just all part of the learning curve. But having them as a support system was instrumental to helping me grow, because they had a lot of experience and they taught me how to become a better clinician in a very short period of time. But now that I'm more experienced, I feel a sense of pride in paying it forward to our profession. And I've been precepting APPE students and our own PGY1 residents for several years now. And precepting and teaching, it keeps me engaged in the practice of pharmacy. And I really find enjoyment working with the learner who is still putting all the pieces of the puzzle together. I like to show them I'm willing to be as vulnerable as they are, and together we can both identify gaps in our knowledge base, and both of us strive to become better practitioners every day.
So you mentioned professional development, which is important across many career paths, and obviously it's important in the pharmacy profession, any medical profession, because of the nature of the industry and how it's ever evolving. You mentioned how how somebody reached out to you, kind of cold called you when they had an opening in Santa Rosa, and because they remembered you from your time there. What advice can you offer to help our PharmD graduates build a successful pharmacy career in terms of professional development opportunities, the kind of contacts that they make, the formal and informal networking that takes place when you're out on rotations and things of that sort?
Yeah, that's a great question, Glenn. And I don't know if anyone in the audience hasn't heard this yet. You will hear it, and it is true what they say, that pharmacy is really a small world. And the old saying of "it's not what you know, but who you know" really holds true for our profession. And like I said, I could personally attest to that several times in my career. That, like you said, in Santa Rosa, I was hired for a position based on a personal reference from like alumni, and of course, when they shot my resume or CV to the hiring desk, the director of the hospital pharmacy remembered me as a student, and they passed my CV around, and all the staff pharmacists and preceptors remember me, and they were happy to, of course, offer me an interview, and it was a slam dunk for the hiring process. And conversely, I've been in the practice over 10 years now, and recently we just hired an internal medicine specialist that was one of my very first emergency department elective students, and she was a rock star. And when she was looking to transition from Tucson to Phoenix due to family relocation, she was looking for a job. I said, "Hey, yeah, we have this opening. Critical care. It's something that I think you've been well trained in through PGY1 and PGY2, and I'm going to slide your application to the hiring desk and let them know that I personally know you and that I vouch for your work ethic." And of course, she got hired, and I could go on and on with stories like that. So just be mindful that you may not know if people are watching you, but they always are. So, put on your professional etiquette, go out there and try your best, be nice to people, because it'll come full circle eventually. And, to enter the job market, it usually just takes more than just a pharmacy degree and a license nowadays. Your ability to get hired or even get a foot in the door for an interview may depend on your professional network, like we talked about. And, the people that will they advocate for you? So my advice is, if you can, get involved by volunteering, things like health fairs or any healthcare related event. And of course, you will inevitably make these connections through your charity work. And so if you're already giving some of your free time, it already gives you, or whoever's looking at you, a good impression that you're willing to step up and help, even though you're not asking for anything. Or, take some time to work on your elevator speech as well. That's something when I do interview preparation for people applying to residency programs, we'll set up a little mock interview, and I say, hey, you should really refine your elevator speech, because you could probably answer 3 or 4 of your interviewee panel's questions with just a good solid elevator speech. So your first impression can make or break a potential professional relationship, so you should make it count. Your introduction also should be concise and informative, but hopefully leave that person curious to want to learn more about you as well. And I like this way. I like this too. If you can attend like pharmaceutical industry sponsored events, like the drug talks, then I think this is definitely an excellent way to network yourself. The environment is usually very relaxed, and it creates a low stakes atmosphere for you to meet others in the same field or within your same circle and community. And you also get the benefit of walking away more informed about some of the most up-to-date information on these relevant drug topics. So when I do drug talks from people who come to the emergency department, talking about new medications, new indications, I'll meet at some restaurant, and there'll be like a pharmacy liaison or someone who's expert in the field or was part of the drug study trials. And you actually meet a lot of different people from different hospitals or health settings, but they're all kind of local to you. So it's a great way to just meet people you normally wouldn't meet, but still directly related to what you do as far as your career. And try and recognize all the opportunities you have to increase your networking potential, and learn how to market yourself towards areas that gravitate closest to your career goals and aspirations. So if it's something that interests you or something you want to learn more about, try to find opportunities where you can meet like-minded people and become a community of people interested in the same work that you all do. So that would be my advice.
That's great advice, and it actually applies across all kinds of different professions. sounds like it's particularly relevant within pharmacy professions. Like you said, it's a small world. Why don't you discuss real quickly the qualities of a good leader in the field of pharmacy and how leadership skills are developed?
Yeah, even in pharmacy school, I was the president of some of our chapters, professional society chapters. And, early on, I think leadership is something that I think maybe the pharmacy field lacks a lot of. So I hope maybe we could find a way as a profession to work more on development of good leadership. But I'll start off with just first and foremost, we need to recognize that there's really two types of leaders out there in the field of pharmacy. There's, our formal leaders, like our supervisor or someone who has that title of, being a leader. And then of course there's our informal leaders, like that coworker that you really respect because they always never flounder in a very tough situation, or they have all the expertise, so they have all the answers to all the questions that come up. So this person is looked up to for their guidance and their expertise, and whether they want to be a leader or not, they are definitely a leader of the group. And for either of these leaders to be successful, I think it's really important that they have to have the ability to lead by example. We frequently look towards our leaders to see how they're going to handle a difficult situation. And then, of course, how they handle that situation, we use them as role models for how we should behave in similar situations. So, for anyone who wants to step into leadership or notices that they're being looked at like a leader, you got to be aware of this. And to be successful, you can exert your influence and help motivate others and support, I guess, certain visions and goals, once again, by just leading by example. How do you want the group to behave? And if you set that standard, then of course they'll follow suit. And then it comes down to like motivational techniques. And so one thing that I like to use a lot at my job is just to be passionate about certain projects or ideas. It's much easier for us to be inspired by someone who is passionate about something than it is to follow along with someone who is, shows disinterest. And, positivity is infectious. And sharing the reasons why you or they believe in something is really a good way to get others inspired to contribute their help towards reaching a common goal. I hear it a lot in my job. We have more and more tasks to do and little or less and less resources. But, if you show that you're truly passionate about it, people are willing to give up a little to almost none of the bandwidth they have left just to help you out, help you succeed. They want to see you cross that finish line. And that's really what it takes. Good leaders also have the ability to, actively listen to the group and when they need to compromise in order to create a buy-in. So you can't just force things upon people unless you understand what their wants and needs are too. And of course, it helps to just meet in the middle so that everyone has like a win-win situation. Without the group support, you're bound to fail. Good leaders, I think they also set clear expectations and hold people accountable for their performance. With my APPE students and my residents, when they're with me on my rotation, that's one of the first things I like to do on orientation day is set clear expectations on what their role is and what their job function is and what it is they're supposed to learn from me with like a syllabus on day one, so that should we ever get off track, it's like we have something to hone back on, something to use as a compass to get back on track. And so with setting clear expectations and holding people accountable for the performance, I think, we should also need to provide them with the resources and the training to do their job first and foremost. And then, if anyone's ever underperforming, we need to not be punitive of them, but also, I guess, be a coach or more of a role model to find out, what's hindering them and how can we help offer them the guidance and support so that they can now meet these expectations that have been set. And of course, if, underperformers or, these issues are never or not routinely assessed and corrected, then the whole group will see, hey, someone's sliding by without doing their share of the work, and that will really just erode the motivation of the others and, the overall performance of the group. So that's kind of what I've seen in the last 10 years of my practice. And, just to keep it simple, I would just keep it at that these are the things I think we need to focus on as far as being the good leader in our profession.
Yeah, well, that's great insight, and thank you for sharing with us. So we're about at the end of our time here. So I want to I want to thank all of our listeners for tuning in and thank Dr. Carrasco for joining us. Until next time, take care, everyone.
Take care. Thank you, Glenn.